So this is the most important thing I have covered. What is COVID? How do you get COVID? How do you protect someone? When somebody gets COVID, and how do you quarantine? And what are the measures you have to take at home? And when you get better, what are the measures you should take? When you go to office, what are the things you should follow? So now I'm going to cover some basic things about vaccines. These are the vaccines available in India. For the people who are joining from the United States, I think you have two other vaccines, the Pfizer vaccine and the Moderna. But in India, predominantly, these are the two vaccines, Covaxin and Covishield. The Sputnik 5 has been recently, this is recently approved. It is still not available for general public. But I'm sure everyone would have heard about these two terms, Covaxin and Covishield. I'll cover the basic, I'll touch base about the differences of all the three vaccines. Even I would like to discuss with you about the Sputnik vaccine also, because in the near, it is going to be approved and it is going to come into market very soon. So you can have a knowledge about all these three vaccines. See, the first common question most of which vaccine is the best vaccine. So, at present it is very difficult to say. There is no head-on-head trial about any vaccine. Comparing Covaxin with Covishield or Covaxin with Sputnik or Covaxin with Pfizer vaccine or Moderna vaccine. There is no head-on-head clinical trial. So this is like asking which eye do you like, right eye or left eye. So it is not like, in current situation, whichever vaccine you get, it is always safer to take. It is important to take vaccine. I'll tell you why it is important to take vaccine in the coming slides. But whichever is available in your near vicinity, you can take the vaccine. See, Covaxin is a vaccine which is made entirely in India by all the materials, everything with technology, completely by the Indian company called Bharat Biotech, which has an efficacy of around 81%. And recently, even the US task force, Dr. Fauci also gave a statement that Covaxin is able to neutralize lots of variants of COVID, especially the Brazilian variant, the South African variant, and the UK variant. Along with that, there are 617 variants, 617 variants it is able to neutralize. So that is one special thing which is recently published. I would like to update you about that. So Covaxin has a good efficacy among a lot of variants. Covishield is a vaccine. Again, it was developed originally by the UK, the Oxford University, and now it has been manufactured in India by the Serum Institute. And the Sputnik vaccine, as everyone knows, it is from the Russian soil. So at present, who can take the vaccine? The government of India has approved for all persons above 18 years. And anyone above 45 years with comorbidities, and I'm sure most of the population here would be around 30 to 50, 30 to 60. So most of you here would be eligible to take a vaccine. Whenever whoever is not vaccinated so far, please go and get a vaccine. There are a lot of stigma, there are a lot of negativity, there are a lot of anti-vaccine groups all over the world propagating a lot of negative things about vaccine. Absolutely false. Absolutely false. There is no doubt about it. Whatever doubts you have about vaccines, you can please post your questions. But in my view, vaccine is a very important weapon like mask and hand wash. It is equally, when you wear mask, when you do proper hand wash, and when you take a vaccine, these three, you are going to be protected 99% of the time. Very, very sure. If you take a vaccine, but you don't wear a mask, then there is a chance that you may get infected. Please remember this. Getting a vaccine, it doesn't mean that you should not wear mask or do not follow social distancing. This is a very important thing. Most of them who took the vaccine and got the disease are the ones who do not follow these norms. Most of them. So, how many shots? Most of the COVID vaccine, almost I think every COVID vaccine available in the world today has 2 shots. Because since it is a new virus, we need a booster dose to prime the immune system to work effectively. So for a Covaxin, you can take the second shot in 4 to 6 weeks. For Covishield, which is the common vaccine which is now available in India, the initial studies showed that you can take the vaccine after 4 weeks. But now the latest studies published in Lancet clearly shows that you take the vaccine in 6 to 8 weeks or even up to 12 weeks. But in India, mostly it is recommended from 6 to 8 weeks. My suggestion is take the second dose of vaccine from 6 week to 8 week or 6 to 10 weeks to get the maximum of the vaccine. When I took the vaccine in the month of March, I took in 4 weeks. But after that, the latest guidelines clearly say that take the vaccine in 6 to 8 weeks. Another common question is, after taking one shot of vaccine, am I protected? The answer is no. You are not protected 100%. You are protected probably 30%. And after taking the second shot, are you protected immediately? The answer is no. You are not protected immediately. It takes usually 2 to 4 weeks to get adequate antibodies in our body. Antibodies meaning it is the one which protects when you get exposed to the virus in future. The antibody is like a lock and key mechanism. You can see the lock and key. The vaccine produces key in the body. When the lock comes from outside, lock and key locks and then destroys it. This is what is the simple way in which a vaccine works.